If you have discovered a new, firm, movable, dome-shaped lump beneath your skin, specifically on your face, neck, back, or scalp, it is highly likely you are dealing with a benign skin cyst. Let's look at exactly what this means, how to identify it, and the correct medical steps to take. To give you complete clarity, this video covers 4 essential areas. First, the exact biological mechanism behind how these lumps form. Second, a direct comparison of the 4 main types of skin cysts and their distinct physical symptoms. Third, the specific medical specialists you need to consult for evaluation or permanent removal. And fourth, the evidence-based protocol for managing a cyst safely at home without triggering an infection. Biologically, a skin cyst is a non-cancerous, closed sac lined with epithelial tissue that develops within the dermis layer of the skin. They form when a pathway, such as a hair follicle or a sebaceous oil gland, becomes obstructed by dead skin cells, oil, or keratin proteins. Instead of shedding normally, these cells become trapped, multiply, and form an independent capsule that secretes a thick, protein-rich fluid. Because this fluid is locked entirely within its own structural sac, the mass remains completely self-contained, allowing it to move slightly under pressure rather than feeling fixed to the underlying tissue. Skin cysts are classified into 4 primary types based on their cellular origin and location. First, epidermoid cysts. These are the most common, appearing frequently on the face, neck, and torso. Their defining diagnostic feature is a punctum, a small dark central pore in the middle of the lump. They are slow-growing and completely painless unless irritated. Second, true sebaceous cysts. These are less common, form directly within oil glands, are filled with a greasy, yellowish fluid, and occur mostly on the scalp and upper body. Third, pilonidal cysts. These form exclusively at the top of the tailbone cleft, often due to friction and ingrown hairs. They carry an exceptionally high risk of infection, rapidly turning into painful abscesses that drain fluid. Fourth, hidradenitis suppurativa. This is a chronic inflammatory condition, causing recurrent, painful, deep cyst-like clusters in areas where skin friction occurs, such as the underarms or groin, requiring long-term medical management.
For an initial evaluation of any new skin lump, you should consult a primary care physician or a board-certified dermatologist. A dermatologist can confirm the benign nature of the cyst via visual examination and palpation. If you desire removal for cosmetic reasons, especially on the face, a dermatologist is ideal, as they utilize minimal scarring excision techniques. However, if the cyst has grown significantly large, sits deep within the muscle tissue, or has become acutely infected, you will be referred to a general surgeon. A general surgeon performs a routine, in-office excision under local anesthesia to remove both the interior fluid and the outer sac wall entirely, which is the only way to prevent the cyst from recurring. Regarding home care, the primary clinical rule is to never squeeze, pop, or puncture a skin cyst. Squeezing forces the trapped keratin and bacteria deeper into the surrounding dermal layers, causing the internal sac to rupture. This triggers severe internal inflammation, tissue damage, and significantly increases the risk of a secondary bacterial infection. The only medically sound home intervention is the application of a clean, warm, damp compress to the area for 10 to 15 minutes, 3 to 4 times daily. This localized heat dilutes the trapped fluid and increases regional blood circulation, helping the body soothe the surrounding tissue until you can be evaluated by a medical professional. Understanding the precise mechanics of skin cysts removes the uncertainty and allows for safe, logical health management. In our next dedicated video, we transition from superficial skin structures to internal medicine, covering the symptoms, causes, and specialized treatments for internal ovarian cysts. Please note that this content is entirely educational and does not replace professional medical diagnosis. If your skin lump exhibits rapid growth, severe redness, heat, or localized pain, please consult your healthcare provider immediately. Subscribe to Disease Symptoms to build your medical literacy, and we will see you in the next analysis.